Hypothyroidism, often referred to as an underactive thyroid, is a common condition. It occurs when your thyroid gland doesn't produce enough thyroid hormone. This hormone plays a crucial role in regulating your metabolism. Think of it as the body's internal engine, controlling how quickly you burn energy and how efficiently your organs function. When there's not enough thyroid hormone, everything slows down, leading to various symptoms. The thyroid gland, shaped like a butterfly, is located in the front of your neck. Don't let its small size fool you. This gland is a powerhouse, impacting nearly every aspect of your health. From energy levels and heart rate to body temperature and mood, the thyroid plays a vital role. Understanding hypothyroidism begins with recognizing the importance of this tiny gland and its impact on your overall well-being. The thyroid gland is a true multitasker, responsible for producing, storing, and releasing thyroid hormones into the bloodstream. The two primary hormones it produces are thyroxine, or T4, and triiodothyronine, or T3. These hormones act like messengers, traveling throughout your body to regulate metabolism. In essence, thyroid hormones control how your body uses energy. They influence your heart rate, body temperature, and how efficiently you burn calories. They also play a role in digestion, muscle control, and even brain development. When the thyroid is functioning correctly, it releases just the right amount of hormones to keep your body running smoothly. However, when it becomes underactive, a cascade of effects can occur, disrupting your body's delicate balance. While anyone can develop hypothyroidism, certain groups are more susceptible. Women, particularly those over 60, are at a higher risk. This is likely due to the hormonal changes associated with menopause. Having a family history of thyroid disease, including hypothyroidism or Hashimoto's thyroiditis, also increases your chances. Other risk factors include autoimmune diseases, such as type 1 diabetes or rheumatoid arthritis. Treatment for certain cancers, such as radiation therapy to the neck or head, can also damage the thyroid gland, leading to hypothyroidism. Additionally, certain medications, iodine deficiency, and previous thyroid surgery can increase the likelihood of developing this condition. It's essential to be aware of your individual risk factors and discuss any concerns with your doctor. Hypothyroidism typically arises when the thyroid gland fails to produce enough thyroid hormone. One of the most common culprits is Hashimoto's thyroiditis, an autoimmune disorder where your immune system mistakenly attacks your thyroid gland. This attack can damage the gland, hindering its ability to produce hormones efficiently. Other causes include thyroid surgery. Removing all or part of the thyroid gland, often due to nodules or cancer, can lead to hypothyroidism. Radiation therapy to the neck and head, used to treat certain cancers, can also damage the thyroid gland, affecting hormone production. In some cases, hypothyroidism can be a side effect of certain medications used to treat other conditions. Additionally, congenital hypothyroidism, where babies are born with an underdeveloped or malfunctioning thyroid gland, is another cause. Recognizing the symptoms of hypothyroidism is crucial for early diagnosis and treatment. Unfortunately, these symptoms can be subtle, often mimicking those of other conditions, making them easy to overlook, particularly in the early stages. One of the most common signs is fatigue. You might feel constantly tired, even after a full night's sleep. Other telltale signs include unexplained weight gain, despite no changes in diet or exercise habits. You might also experience increased sensitivity to cold, constipation, dry skin, and hair loss. Some people also report muscle aches, joint pain, and carpal tunnel syndrome. Depression, mood swings, and difficulty concentrating are also associated with hypothyroidism. If you experience these symptoms, it is essential to consult your doctor for a proper diagnosis. Diagnosing hypothyroidism typically involves a two-pronged approach: a clinical assessment and blood tests. During the clinical assessment, your doctor will review your medical history, including any family history of thyroid disorders. They will also inquire about your symptoms, their severity, and how long you've been experiencing them. The next step is blood tests, primarily focusing on measuring the levels of thyroid-stimulating hormone, or TSH, in your blood. TSH, produced by the pituitary gland, acts as a messenger, signaling your thyroid to produce more hormones. Elevated TSH levels usually indicate an underactive thyroid, as your pituitary gland is working harder to stimulate hormone production. Your doctor may also order tests to measure T4 levels, providing a clearer picture of your thyroid function. The cornerstone of hypothyroidism treatment is levothyroxine, a synthetic form of the T4 hormone. This medication works by replacing the hormone your thyroid gland isn't producing sufficiently. The goal of treatment is to restore your hormone levels to a normal range, alleviating your symptoms and improving your overall health and well-being. Your doctor will determine the appropriate dosage based on several factors, including your age, the severity of your hypothyroidism, and other medical conditions you might have. It's important to note that finding the right dosage often requires patience and might involve adjustments over time. Regular blood tests will be necessary to monitor your hormone levels and ensure the medication is effectively managing your condition. Taking levothyroxine correctly is crucial for its effectiveness. Here are some practical tips to ensure you're getting the most out of your medication. Consistency is key. Take your medication at the same time each day, preferably on an empty stomach, 30 minutes to an hour before breakfast. This helps optimize absorption. Timing matters. Avoid taking levothyroxine with other medications or supplements, as they can interfere with its absorption. Check with your doctor or pharmacist for potential interactions. Storage is important. Store your medication in a cool, dry place, away from direct sunlight and moisture. Never skip a dose. Even if you feel better, don't stop taking your medication without consulting your doctor. Skipping doses can disrupt your hormone balance and lead to recurring symptoms. By following these guidelines, you can help ensure your body is consistently receiving the right amount of medication, maximizing its effectiveness in managing your hypothyroidism. Section 9. Special considerations: pregnancy, older adults, and hypothyroidism. Managing hypothyroidism during pregnancy requires special attention. Untreated or poorly managed hypothyroidism during pregnancy can pose risks to both the mother and the developing baby. Pregnant women with hypothyroidism often require higher doses of levothyroxine to meet the increased demands of pregnancy. Older adults with hypothyroidism might also require adjustments in their treatment plan. Age-related changes in metabolism and other medical conditions can influence medication dosage and effectiveness. Regular monitoring of thyroid hormone levels is crucial for both pregnant women and older adults to ensure they are receiving the appropriate treatment. Section 10. Lifestyle strategies supporting your thyroid health. While medication is essential for managing hypothyroidism, certain lifestyle modifications can complement your treatment and support your overall thyroid health. Eating a balanced diet rich in fruits, vegetables, lean protein, and whole grains provides essential nutrients for thyroid function. Regular exercise is another crucial component. Physical activity helps boost metabolism, improve energy levels, and enhance mood, all of which can be affected by hypothyroidism. Prioritizing stress management techniques such as yoga, meditation, or deep breathing exercises is also beneficial. Stress can exacerbate hypothyroidism symptoms, so finding healthy ways to manage stress is vital for overall well-being. Section 11. When to seek help, recognizing warning signs. While levothyroxine is generally safe and effective, it's important to be aware of potential side effects and when to seek medical attention. If you experience any of the following, contact your doctor immediately. Allergic reactions. Symptoms may include hives, itching, swelling of the face, lips, or tongue, or difficulty breathing. Signs of hyperthyroidism. These can include rapid or irregular heartbeat, unexplained weight loss, tremors, and increased sweating. Worsening hypothyroidism symptoms. If your symptoms worsen or don't improve with medication, consult your doctor. It's important to remember that thyroid hormone levels can fluctuate, and adjustments to your medication or treatment plan might be necessary. Regular checkups and open communication with your doctor are crucial for optimal management of your condition. Section 12. Living well with hypothyroidism. Key takeaways. Living with hypothyroidism requires a proactive approach to managing your health. Here are some key takeaways to remember. Understanding your condition. Knowledge is power. The more you know about hypothyroidism, its causes, symptoms, and treatment options, the better equipped you'll be to manage your condition effectively. Early diagnosis and treatment, recognizing the signs and symptoms early, and seeking prompt medical attention is crucial for preventing complications and improving long-term outcomes. Medication adherence. Taking your medication as prescribed and following your doctor's instructions is vital for maintaining optimal hormone levels and managing your symptoms. By taking an active role in your healthcare, adopting healthy lifestyle habits, and working closely with your doctor, you can live a full and fulfilling life despite having hypothyroidism.